All right, we are live. Welcome, everyone. I see Dave and Colleen. Hey, you guys. Kushbu. Why don't you, while we're waiting for the room to fill up, why don't you guys just send me a chat? Say hi, say where you're from so that Dr. Thomas knows who's here. And
Hey
just
guys.
make sure make sure it's selected to all panelists and attendees. That way we can all see each other. Hey, Megan.
Hey Dave.
Dave, you've got to switch yours, all panelists and attendees, otherwise no one else can see you. Awesome, Kristen, you got it. All right, thank you guys for being here. I'm just going to give it a couple more minutes and then I'm going to introduce Dr. Thomas and we're going to talk about the Latch Circle. I see Colleen, she's from San Jose. Awesome, thank you, you guys. Hey, Parisa. Good to see all of your names. I know some of you guys are graduates, so you don't get to be on calls with me all the time anymore. Hi, Jessica. Hey, Tamara. All right, so let's give it a couple more minutes. There are about 30 of you in the group so far. Oh, Keiko, you're here from Japan. Hey. Keiko, make sure your name is switched to all panelists and attendees. Same with you, Kushbu. That way everyone else can see you. Otherwise, only me and Dr. Thomas can see your comments. So, hey, Deborah. All right, so I think let's wait until 5:32 and then we'll officially get started. I know it's kind of a cool topic today, so I'm really eager to get into it. Dr. Thomas is a good friend of mine. I'm going to introduce him in a minute. All right, Keiko, yeah, you got it. Hi. Okay.
How do you keep? You're a master of this. Holy cow! I'm just like in awe, just watching this all happen.
Thank you.
You're like the new Ryan Seacrest.
Oh. All right, you guys. Well, there's 34 of you here. There were about 80 people who registered. So, you know, there might be some more people trickling in. I know a couple people emailed me and asked, you know, is it okay if I join late? It's totally fine. Glad you guys are all here. Hey, Anne. So why don't we just start the formal introduction and then I'm going to stop talking. I'm going to pass on the camera to Dr. Thomas. But for any of you guys who know Dr. James Thomas, he goes by JT, and so maybe you guys might hear that name floating around, but he is a dentist from Bellevue, Washington. He's the founder of a very successful pediatric practice that he actually doesn't own anymore. He sold it several years ago, Every One by One. And that's really how he got a start in, I think, looking at tongue ties and tethered oral tissues and all of these things that he's really passionate about today. The mission of that practice was pretty cool. So he's always had a good vision. His goal for that office was to get every single child into their first dental exam by age 1. And I think he did pretty well at accomplishing that goal. I met Dr. Thomas in 2017 when he was just getting going, and you'll have to remind me of the year. Maybe I'm off on this, but just getting Healththat started, which is a specialized
2017,
practice.
yeah.
2017, yeah, that's what I thought. So that is a specialized practice in tongue tie, lip tie, all things breastfeeding and really helping moms and babies and you know, dealing with these oral restrictions. So that has kind of evolved, and now he is here talking about the circle, which is technically the Latch Circle. We started chatting about this back before COVID at the American Laser Study Club in, when was that, February?
Yeah, just right before COVID, so late January, yeah.
Yeah, and so I heard this idea. It's kind of like the LinkedIn of tongue tie myofunctional therapy, functional, I want to say dentistry, but it's so much more than that. You guys all know that. So that is what he's going to be sharing with us today. And I just want to say before I turn it over to him, Dr. Thomas is a visionary. He's a collaborator. He's really a mover and a shaker in the field, and that's why I'm so honored and happy to have him here. He's someone I consider a really good friend. I'm happy to have you as a colleague, Dr. Thomas. So thank you so much for being here. And thank you to everyone else for being here, listening in. I know you guys are taking time on your weeknight to hear this message. I really appreciate it. So without further ado, I'm going to turn it over to Dr. Thomas and let him share his story. And by the way, you guys, if you want to comment, Ask questions. Please share in the chat. I'll be keeping an eye on that for Dr. Thomas so he doesn't have to. If you guys do have a specific question, post it in the Q&A box, and that way I make sure I don't miss it. But otherwise, enjoy the lecture tonight and presentation. And I think, JT, you like to keep it interactive, right? So if they've got questions, we can kind of keep it casual.
Yep, totally. No, that's fine.
All right, go for it.
Yeah, no, thank you so much. And again, thank you, Sarah, and for having me. If I was to give you kind of an overview, I don't have any specific agenda. Definitely want to take you inside the Healththat Circle, which is kind of my newest creation. And but just, I see a lot of Seattle people here, which is awesome. And to take you all the way back, I probably, you're going to see a recurring theme of brand. And I know a lot of you are out pioneering yourselves, getting your own individual businesses going. And if you have any questions about that kind of stuff, that's usually right up my alley. I hope I don't disappoint too much. I'm totally willing to, show some clinical slides of the babies. I see babies 0 to 3 months here. I'm willing to open up to some of that stuff if you want, but I think you've had a lot of that, in general. You just had Richard Baxter on, right?
Yeah, I did a webinar with him. People, I wouldn't say everyone from this group got to see him talk because,
Sure. Yeah. So I'd be glad to do anything you want, but I don't know if I can compare to Richard Baxter, but we all kind of have our different talents, and that's part of what the Healththat Circle is. But let's start kind of at the beginning. So I went to the University of Michigan for pediatric dentistry and residency. I think a big part of my education is just kind of understanding that dentistry kind of chose me and I didn't choose it. A lot of people, dentists, have stories of family members that were dentists and things like that. I made a promise to my father-in-law that I'd have a job by the time I got married, and I chose dentistry, and off we went. So Sarah knows a little bit about my story, but so then I actually finished dental school a little bit early. They sent me to a prison and some other places to kind of spend my last year of dental school as my other fellow students kind of finished up. And I actually was thinking I wasn't going to practice dentistry at all. I thought I was going to go into like more business of dentistry. And then I kind of went to a children's health camp in the Upper Peninsula of Michigan, and there was a general dentist there I was working under, working on special needs kids, and he was like, "Wow, you're really good with these kids." And so the older adults weren't really fitting me very well. I would say just my personality of really going after prevention. And so I then kind of took them up on it and decided to apply for pediatric dentistry, and I love it. I absolutely love it. It fits me like a glove. Being with the kids and starting early is really what I'm all about. And I have been my whole career. So after residency, literally the day after I got graduated and bound my master's thesis at the University of Michigan, I flew out to Washington, not really knowing anything out here in Seattle at all, not having any family. We just kind of hit the ground running.
Why did you come here? I'm so curious. What brought you here?
I honestly, I came out one time to visit my buddy, and it was actually in the wintertime when it's all gray and dark out here, but it was so nice that day. I kind of got tricked, I guess. Mount Rainier was out, and I just fell in love, and then we just decided to pick up and come. And so, it's been good. And I worked underneath a gentleman. I definitely, just like you have MyoMentors and things like that, I definitely have 3 people that are, I think, a pivotal part of what I call my Mount Rushmore. I learned under, his name was Bud Straffen, who is amazing at behavior management. And I would say my behavior management skills are pretty high for children and adults. And then I worked under Dan Cook when I moved out here to Seattle. He's a kind of a big name. A lot of pediatric dentists worked with him out here, and he was systematic. And I'm a very systematic person, as if some of you know me. And then lastly, I worked underneath a gentleman named Pat Laughlin, and he ran a Medicaid clinic up in Mount Vernon. And I know there's some Seattle people here. And he just kind of taught me high volume dentistry using restorative hygiene at a very, very high level. And so I'm kind of a merger, a Twix bar between all those 3 different people, and they made me who I am. And off we went. And so I worked for Dr. Cook for about 6 months, and then decided to open my own practice. I knew we were going to do well, but I really didn't know what was coming. So I started, the first practice was actually, and this is where brand kind of comes into play. And I really think that's what you could probably learn from me the most, is how I've used brand to kind of make things grow. But the first office was called NW, like Northwest Pediatric Dentistry, because I had this vision that I'd have an East-West and a Southwest and all sorts of stuff. And then we started cruising along, and we were growing, and we were keeping kids really clean. And I just decided to open a second office, and getting two offices to function systematically in two different locations and give the same service was difficult. I really had this love for starting earlier. And the American Academy of Pediatric Dentistry talks about getting a child to the dentist by age 1. And we were seeing everyone, Medicaid kids and everything. And so I rebranded the two offices to be what was known as Every One by One, as Sarah had mentioned. Now, guys, some of the stuff you'll do in brand, it'll make sense to you, but it won't make sense to other people, especially at first. And I cannot tell you how many calls I got from colleagues and things that were like, wait a second, what's going on? And people saying, I can't believe it doesn't have the name dentistry in it.
Yeah.
But if I was to tell you what really the magic that happened with the brand pretty quickly was the largest pediatrician group here in Seattle. At that point, it was named Pediatric Associates. They actually started organically saying, have you had your every one by one visit to every one of the little kiddos that came through their clinic for well child visits. So now we're starting to make a movement, right? We're starting to make something that's actually driving at prevention.
Which
And
is
so I was
amazing.
happy, and we went
Yeah,
from
you probably won't brag too much, but I mean, it was a big practice. Do you want to say how many patients you had?
Yeah, we were, at one time, probably active patients, we were probably past 10,000. I would probably say 12,000. I was seeing about 80 kids a day
Yeah.
with an amazing team.
Amazing.
Um,
Yeah,
yeah,
amazing.
culture was super high. Culture is just how everybody is bought into the mission. And the biggest thing is we went from seeing about 5 new infants a day when we got rebranded to seeing about 30 new infants. And at that point, we were keeping kids clean enough. And this is a big part of the story. And I think the audience might enjoy this, but I started data tracking the kids based on their symptoms, and just like crowding and open mouth breathing. And at that point, I hadn't had that light that so many of us have had, where the light turns on about all the airway and all the vagus nerve and everything that comes together with the amazing things that you guys are doing as myofunctional specialists. But there were 2 things that stood out me in the data set, and one was the amount of extractions I was doing in the baby teeth of all different nationalities. As you know, in Seattle here, all the big companies, the Microsoft, Boeing, they bring people from all over the world. So we're international here in Seattle. And so despite their genetic background, I was basically doing serial extraction on a majority of the kids as their first teeth came in and took out the 2 lower O and P. There was just no room. So then we had to take out 4 teeth just to get 2 teeth in. And you kind of start this process because you're losing room, you're losing the leeway space in other areas, and you're just kind of going through serial extraction. So,
Wow.
for me at that point, since I didn't, let's say, love dentistry, and I kind of fell into it, I was like, this just doesn't feel right that I'm having to extract all of these teeth, And then the big aha moment for me was there was about 250 kids in the practice that were not potty trained past the age of about 7 years old. So, and if you stick with me, which I'm sure you already kind of understand, but the vagus nerve is in the mouth, right? And if we're open mouth posture and we're not lifting the tongue and we're not relaxing that vagus nerve with our mastication, as you know, I'm making it very simple, but right, the parasympathetic nervous system is basically awake at nighttime because we're not, we're not nasal breathing. And so basically the track is awake, but the eyes are closed, is what I used to say. And at that point, I didn't really understand it. I was, the light kind of turned and I was like, well, how does urination have to do with, breathing, right? But the one thing that drove my passion was, if you can imagine, those kids were disheveled, can't go to a birthday party, can't go to, a sleepover, right? They're in pull-ups, at age 7, wetting the bed.
Yeah, sad.
And one of the things I used to do, because I love behavior management, is I used to sit in front of those kids and I used to just say, it's not your fault. It's not your fault. And I
Aw.
used to repeat it. I used to repeat it because they were told a lot of times that it was their fault, right? They were told that, why can't you not, hold your urine, right? Because the doctors were saying, well, there's nothing wrong with your urine or the ability to hold your urine anatomically. So they would take it on their heart that it was their fault. So I would sit in front of them until they actually, what I call broke, which was they actually started to cry, male or female, because that moment's really big, because for the first time they can let go and say, it isn't my fault. And then
Yeah.
so we took 10 of
So
10, sorry, go ahead.
really quick on that, because one of the students here, actually, she's a MyoMentor graduate, and she's actually doing research on this, and she's really passionate about it. She just wrote in the chat, bedwetting causes scars, and
Yeah.
it's so true. And so I know that that's kind of an area of interest for her, and something that she's putting together as part of a paper. And yeah, so you're connecting with at least her, and I'm sure a lot of others here. So.
Yeah, and I mean, I think even on the adults, we are, the little known secret, we are seeing a few adults here at Healththat, even though I'm
Ooh,
mostly
okay, that
focused
is a
on babies.
secret.
I have an amazing naturopath here that I work with every day, and she's starting to see the adults. But one of the things she's finding is that she needs a psychologist. She needs someone to refer to for the adults that have a lot of emotional needs that she's not going to handle in her chair. She's going to be a good doctor, but she needs someone to refer to. So back to the kids, we took about 10 of the kids, the worst of the worst, and gave them free treatment. Okay, that meant anything they
Wow.
needed. It didn't matter. So these were kids were ADHD, hyperactivity, open mouth breathers, not sleeping well. And we obviously figured out that most of them had a tongue tie. They all needed myofunctional therapy. And we brought some faces back, meaning that we actually have before and after pictures where we grew some faces without mild munchie and mild brace at that time. So then, yeah, the light kind of turned on for me. And then as we all know, we kind of usually have some sort of personal story. And going back to school at the University of Michigan, my second born, I had two kids when I was in school, and my second born didn't latch very well, had tons of projectile vomit and reflux. We were told that it was normal, and it progressed until she was about age 1. And right before we moved to Seattle, she aspirated it into her lungs and she got pneumonia, was hospitalized, high dose antibiotics, which eventually blew out her 6-year molars. So it definitely has a personal story, because at that point, right, as a young pediatric dentist, the University of Michigan's the best dental school, I think, still in the world. And so I didn't get anything about tongue tie. So it wasn't even on my radar for my own daughter. She eventually grew a full underbite. Maxilla was deficient. It wasn't until I put this all together and she was about 7 that I figured out that she had a problem, and it was sitting in my own household. So I tell you this whole story because the Everyone by One brand eventually grew large enough that in 2016, after a lot of debate, I decided to just walk away. And to be honest with you, I did not think I was coming back to dentistry. I probably signed the largest non-compete ever in dental history, because I was like, nope, I'm not coming back. And I was focused on going into business of some sort.
That always gives me chills when you say that. I get goosebumps.
I helped my cousin in Wisconsin start a drone company. I climbed a lot of mountains. I did American Ninja Warrior. And then my wife was kind of like, you probably should keep up your dental degree. And
Your license?
My license. Sorry. Thanks, Sarah. And so I started doing a little CE, and that's when I bumped into the stuff about tongue tie. And I'm sure just like I'm speaking to the choir, but it was like in that moment, sitting in that room, where everything came together. And what I mean by everything, if you can imagine I don't know, the number, like hundreds of thousands of exams I did over, what was quite a long career with a high volume of kids. It was like I finally made that connection. And then it was like I was rewinding my life through each of those exams, saying, how many kids did I miss? And
Yeah. Oh my
that's
gosh.
what drove my passion.
How many, you guys just comment in the chat so Dr. Thomas can see how many of you guys relate to this story. Say me or yes, or I know Tara already said we have almost the same story. How many of you guys are sitting here like, yep, that's me. I
Yeah.
totally get it. Yep.
So now on to step two. I know it's kind of a long story, but to me, it's really important that you guys hear it because, you know, the things that Sarah talks about that are amazing. A lot of pain came to take, you know, to get it to this point. But really, and I'm just going to be very transparent because people who know me know that I'm very transparent. But when I went around in those original days, and I knew that this was a big issue, not only for our country, but the whole world, this myofunctional tongue tie airway thing, I was looking at like the brand behind it. And I was thinking, man, if someone does not brand this in a way that the general public can understand it, then it's going to miss the mark. It's going to totally miss the mark. It's going to be another one of those things like, I hate to say it, like cavities, right? Like, oh, I got a cavity, you know, like, well, this is something like, oh, I have an airway problem. I can't breathe. It's a
Yeah.
big deal. So are cavities, but it's a big deal. So I started playing around with brand again, you know, because we had so much success with every one by one. And what I mean by that is I really feel like the brand every one by one became a mantra and for my team, for the community, that they knew what we were doing there. So the original play on the brand of Healththat, the clinic, when I opened in 2017, February 2017, was off of Charity Water. So I don't want to say that everything I've done is like my original design, but Charity Water is Charity Water, and it's a group which was tied to my church actually. And it's a guy in New York City who was a nightclub promoter, and he had this epiphany to start building wells in Africa. He was like, if I can charge, you know, $15 for a drink at a club, and then I can throw parties and raise water for wells in Africa. Well, Scott Harrison's gone on to write books. You probably know that name. And he's been all over the world. He's built wells all over the world doing what he's doing. So I thought about latching onto the breast. I decided, okay, I'm going to go to the heart of the problem of these kids, which is the breast. And I'll be honest with you, at that point, I did not have the education I have now. You know, I wasn't hanging out with IBCLCs. I look at the early days of Healththat where no one in my community really understood it. And at least
It wasn't
understood.
that long ago, to be honest.
Yeah.
It wasn't that long. Like so much
Yeah.
has changed in such a short time.
Yep.
It's really amazing. So
Yeah, and it's because of all your work. I mean, it's because all your work, Sarah, and the group, this whole entire group, getting on Zoom calls and talking to each other. I remember in those early days, I started a Google room, and there was like 4 people at first, and it quickly grew into hundreds and then eventually thousands. So yeah, we opened. To be honest with you, in the early days, there was only 3 providers that would send me a baby. It was a midwife, a bold pediatrician at Valley, and then a chiropractor. And everybody else was kind of like, I was getting notes that I was a baby cutter. Those were the good days. And we just kind of decided to build. Well, a big part of my story is, you know, really what you're looking at when you're trying to move walls. And that's what a lot of us have had to do. And that's what the Healththat Circle is going to do with a big microphone now, is you basically got to figure out what are the barriers and how do I get over them. And if you can imagine, it's me answering the phone and I'm getting the name of some babies and I'm trying to call them. Well, no one was picking up the phone because of all the robocalls and just tired parents. And so I actually realized that the problem in getting over this wall was actually the telephone, the physical telephone. So I sought out a HIPAA compliant text messaging system. I actually purchased it, and then I didn't use it for about 3 months, and they were so gracious. They'd call me and they'd say, "Hey, Dr. Thomas, have you sent a text yet?" And I was like, "No, I don't know. I'm a little afraid to send a text to my patients, and I'm still using the phone and it's not working." And so I'm not kidding. I finally sent the first text, and the parents text me right back within seconds. As you guys all know, everybody's using text. And I literally turned off the phone and never used it ever again. So Healththat is run with a text messaging platform called Rhinogram out of Nashville, Tennessee. And then I use encrypted video through a company called Vidyard. And I can send this in the post email if you want. Vidyard out of Toronto. And what Vidyard allows me to do is push a button at any time. I don't write emails anymore. I don't do any of that. You know how much counseling you guys have to give your patients, right? And if you're writing long emails, you gotta figure out how to compartmentalize that stuff so it doesn't take over your life. And as you know, a lot of what we do can take over our lives.
It will.
Yep.
Do you guys relate to that? Like who gets what he's talking about? You guys, the time on the phone and email. I'm sure you guys are familiar with this, right? Like, let me know in the chat, because it's
Amen. I like
amen.
That. Amen. I got a what's up, a little person, a little what's up.
Yeah. No, that's good. You guys are good at emojis. I don't even know how to do that on the computer. I can do it on the phone, but
yeah. Reports take forever. So
yeah.
So yeah, we started to build some systems to collect what I call the story, which is a mom's story. We send out a 74 question Google document, Google Docs. I'm building an online course about what we're doing because I think a lot of people would benefit from it, like what we're doing. But I send out a 74 question doc. The families fill it out. We then know their entire story, which is, in our SOAP notes, subjective, objective, assessment, and plan. It's basically the whole subjective portion of the notes already done as soon as they walk in the door, because we've captured their whole story. And so, long story short, without blowing you out of technology water, Sarah and everybody thinks I'm like a technology guru. I am actually not.
I do. I'm like, how do you do all that?
I am actually not. I am the guy whose printer goes down and I ask my kids to put my printer back online. So, or I'm YouTubing everything. So, but what I am at the heart, guys, is just like kind of relentless problem solving. And that's what you've had to do with your patients over and over again. So we got Healththat off the ground. I am fast forwarding a lot through a lot of pain and a lot of conversations that we have went from 3 providers. I track everything. We've been referred a baby from about 1,700 different providers of all walks of life across Seattle and beyond.
It's amazing.
But what I've seen over time, the evolution was me and a dental assistant doing tongue tie releases. And I got better at tongue tie releases by doing that. I then wanted to go to the next level because some of the lactation consultants I was looking for a lactation consultant, and that lactation consultant, I decided to hire one in office to really help with breastfeeding in the office. And that worked for a while. But I really found that there was a lot more going on with the babies. And I think this part you'll be interested in, which is I would do a really, really good release. And I feel like if there was an Olympics, I would be at the top. Okay, I've got this down. I stand up. I'm a little bit different than most dentists. I actually stand over the baby. But this takes me, I can envision what it's going to look like before I even touch the button with the laser. This takes me probably about 30 seconds to do lip, tongue, and buccal ties if it's needed. And the baby goes right back to the breast. But I felt like even though I was doing good follow-up, good procedure, the babies were still struggling. And so COVID hit, right? And we all got shocked by it. And I decided to make the jump, which was finding the best naturopath I could possibly in Seattle to help me treat the babies together. And not only just treat their tongue tie, treat them fully from head to toe. Because I felt like a lot of babies had reflux, a lot of babies had torticollis, a lot of babies had plagiocephaly, a lot of babies had GI problems, and obviously a lot of babies had oral tethers. So that's what we're doing at Healththat now. We are now becoming known as basically a baby triage clinic. And if you can imagine, at first, the pillar that formed Healththat was this oral tether release, right? Don't get me wrong, we still do that. We are still known for that. Families are still referred to us for that, but it's kind of moved over here. And I would say the foundations is starting at the top, which is 1 out of 2 babies are born with plagiocephaly, okay? So as they come through the birth canal, their head kind of gets misshapen, right? And if you can imagine, this airway's up here, right? So when you misshapen that head, right, what happens to the front? It all shifts. So we're solving plagiocephaly without helmets. So we dive into mom's story and baby's story super deep. and we give one heck of an exam and one heck of an experience, and that's where we're at right now with Healththat.
Yeah, it's an amazing story, and you know, you're sharing all the best parts of it. But I do remember having like a heart to heart with you, and I feel like 2017 or 2018 when you literally said, "I don't know if this is gonna work. I don't know if this is gonna take off," and I was like, "No, I really want it to," you know, and
Yeah.
so I'm so happy that now it's at this place where you've had all these providers and treated so many babies, and now you've evolved so much. It's really, I love your story, so that's why I'm happy that you're here. So I guess I'll let you keep talking.
Yeah, no, feel free to jump in if anybody's got questions. Just put them in the Q&A section. I can jump in between. So how did I get to the Latch Circle? Really, what it was is I built a chatbot to start to automate some of the questions that were coming to Latch from all over the world. And mostly the questions were very similar to what you see on Facebook, which was, I am in Kentucky and I like what you're doing at Latch, but I need someone in Kentucky. And so I used the technology to kind of connect them with people that I knew. I would text Sarah and other people and say, do you know someone in this area? But the thing that was interesting about the chatbot, and I don't even have it on anymore because it kind of got out of control, was the analytics showed me exactly what people and parents were asking. What questions, what hour, how many times was that question being answered, where were the questions coming from? And it really kind of showed me that there was this need, this big need for people to actually find each other and find collaboration. So I just kind of threw together like what it would look like to make a directory. Now, even that short ago, Sarah, when I saw you in Florida at the Light Scalpel meeting, it was truly a directory. It was a very inexpensive project that I was like, yeah, we're going to make a directory and list all the providers. But when I gave the speech at that meeting, so many people came up to me and was like, this is needed. This is really needed. And I do things well. So I kind of took it to the next level. So before I get into the Latch Circle, what ages of babies do you treat? So I see 0 to 3 months. All right. And I know that sounds kind of interesting that I'm in a niche within a niche, but
I was actually going to ask you to share that part because that's like very intentional of why you do that. And that's like a story in itself. So
yeah, so everything that I've done, everything you're going to hear, it's almost got a side story. We don't have all night, but basically the only reason I saw up to 3 months was because all the especially the providers in the area knew me from every one by one and knew that I would take care of kids. And they were basically saying, well, why would you do anything? You can go see Dr. Thomas when he's 1, your baby's growing. So that's where I kind of was like, time out. I'm going to step back and kind of force their hand by saying, I'm going to only see up to 3 months. So if there's an issue, we need to take care of it. Because if I was to tell you, I know you guys are super high-end myofunctional, but on the baby spectrum, I'm going to just tell you from 0 to 3 months. When I treat a baby from like basically, like I like about 4 days to like 15 days, those babies, boom, respond real quick, get back on the horse, don't need a lot of follow-up, usually 1 follow-up. So if we go from like 15 days to like a month and a half, now it's like maybe 2 follow-ups. If we go from like a month and a half to 3 months, now we're looking at like 3 or 4 follow-ups. And that's PT, OT, craniosacral, everything they need. So I guess what I'm saying is you guys got a big job ahead of you because you're standing in front of a 7-year-old, right? That doesn't want to sit still, that has had a lifelong of all this degradation. So yeah, I see 0 to 3 months, but we are creeping up a little bit higher because we are getting known as a triage clinic. So families are actually coming to us now that we're actually not committing to a tongue tie release for them. We're just triaging their situation. And I'll be honest with you, the big things that aren't getting answered out there have a lot to do with GI problem and just behavioral issue stuff. And Dr. Gormley's kind of taking that on. So we are inviting different ages now, but our mainstay every single day is 0 to 3 months. And then Christine said, I'm curious your thoughts for frenectomies on toddlers. Like if toddlers need them, or I'm not sure.
I think she means, doing the frenectomy on toddlers, or if you do that, or, because it's a tough age.
Yeah.
because like they're not small enough to swaddle, right?
Yep.
They're
That's
too
right.
big to like do, or they're not old enough to do myofunctional therapy in the sense that we do it. They're not usually breastfeeding. They can't be swaddled. It's a tough age. So
Yeah. So what I call, and the easiest way for you guys to talk about it without offending anybody, is you call them the pre-cooperative kids.
good one.
And I would say a pre-cooperative kiddo is probably your six month old that you can't swaddle anymore, all the way up to probably, in pediatric dentistry, we can usually get some good behavior out of like a 2 3/4 going on the 3-year-old. We can start to do things, but they have those little white weapons, those teeth in there. So, but yeah, no, I mean, the hardest thing about this is at first, not even that long ago, as Sarah said, it was like, oh, you have a problem, but let's wait a little bit because we're not quite sure how to what's it related to and all that kind of stuff. Well, obviously now the education is getting higher and higher, and with the circle, we're only going to go higher and higher. So families are wanting to get them treated. They don't want to wait. They don't want to wait for degradation. So what I do is I actually pair with a really talented pediatric dentist, Dorothy Nelson, and a couple others. And I really feel like that's not to be handled at Healththat, believe it or not. Even though I'm a pediatric dentist and I feel like I can do it, kind of need a couple more hands on deck and sometimes some oral sedation. And that's just not something that I feel comfortable with doing. So if I was to tell you a big picture is just know your strengths, know your weaknesses, surround yourself with people that can cover your weaknesses, and you're going to be healthy. Yeah. A good practice.
Yeah, team up with the people that are doing that if it's not something you do. I think that's a good strategy. I agree.
Totally. So now onto the Healththat Circle. Are you guys ready for this?
Let us know.
Okay.
Actually, I'm curious, how many people have heard of this before? I talked about it. I know it's been floating around on Facebook and Instagram. Have you guys heard of it outside of me announcing it? I'm just curious, and it's good feedback for Dr. Thomas.
Yeah, Dave, I was like super excited. Dave got on like right away. And
okay.
if you look on there, we wrote a whole article about Dave and Sarah. So that means, so I guess the big thing I want people to know is like, I'm not messing around. Like I want this to be the tool forever. So I hired 7 people. So the thing that's interesting, in my Healththat clinic, I answer every text and send every video and schedule every patient, and it's me and Dr. Gormley. But for the Healththat Circle, which is just getting started, it launched in August to like a beta group, and now it's like pretty much live. I employ 7 people that don't live anywhere near Seattle. So, but anyways, I just know that, I really do feel like this is going to hit pretty soon. I think the turning number is about 100. I feel it starting to get more intense. And because my workload is going up and up and up, I am going to launch some videos in the next, let's say, month to the general public. And I do everything. And this is where I'm going to talk briefly about brand. I talked about everyone by one. I talked about Healththat. And what I mean by brand is people aren't talking about me. They're talking about my brand, right? And the brand, people kind of get it, I think, it mixed up a little bit. And so when I get into the Healththat Circle, I'll kind of tell you what I mean by brand. At Healththat, the values of Healththat are radically kind, fiercely patient, disruptively brave, and defiantly joyful. So every day we are radically kind, no matter how much spit gets thrown in our face. We are fiercely patient. And the Healththat Circle was the part which was disruptively brave. And the defiantly joyful is what we'll eventually get to. So why is it called the Healththat Circle? Because I just tell people I can't write values better than that. They've played themselves out really well. People have really taken to them, especially with how tough times are today. How many people can just use some radical kindness and values like that. So, and then do you mind if I screen share?
Yeah, go for it. I think that's good. It's good visuals. It's interesting how many people hadn't heard of it. So I'm glad that, this is getting some exposure, because most people said that they hadn't heard of it before. So now you've got a whole new audience.
Thank you. And I really do feel like it's key for the myofunctional specialists, because I really believe you guys are pioneering a way, and you're going to have to group together so people understand what myofunctional therapy is and the more solidarity you have on one platform, the better. The goal of the Latch Circle is eventually to deliver a patient to your practice, fully educated about as much as they want on the actual Latch Circle. Let me type it. Can you see my screen, right?
Yep, we can see it.
Okay. All right, I'm going to let's see. All right, so this is the homepage of the Latch Circle. Think of it just like Sarah said at the beginning, LinkedIn. If you know what LinkedIn, you're starting to link yourself to other professionals. The families our brains work in threes, so you'll see a lot of reoccurrence of threes. Learn, trust, thrive. The learn is where they can go and learn lots of information. There's one pillar right now in it, and it's about tongue tie. Now, if you know me well, if anybody's shadowed me, I'm not a tongue tie guy. I treat tongue ties, but I think the world has had enough of tongue tie, okay? We need to start talking about the bigger picture, and tongue tie is a part of that bigger picture, okay? We're gonna need to talk about airway and what you're trying to do. Because, really, I wrote down what I think part of your brand is as myofunctional specialists, as a group. I think your breathe, sleep, grow. I think that's what your brand is. If you were to say simple terms, and that's what the world needs. They need simple terms.
Again, really quick, breathe,
sleep, grow.
I love that. That's good.
I think that's what you guys are. And, your mission statement's kind of your moonshot. Like, what are you shooting for with all your patients? What are you trying to do? Your principles are your core. And at the Latch Circle, our principles are intuition, awareness, and advocacy. Okay. And those words have meaning and emotion to them and passion, and they can be applied to anything. And let me share you an example. Like, we're trying to use this circle to basically parents, let's just take a mom. A mom doesn't have to have a doctor tell her that her baby has reflux. She knows something's up, her motherly intuition. A 7-year-old, a parent doesn't need to know that their kiddo's bouncing off the walls and isn't sleeping properly. Yes, they need that, the diagnosis eventually, but they know something's not quite right. So we talk a lot about intuition. The second phase is awareness. That, the goal of what you're doing with myofunctional specialists is to make people aware, right? Just make them aware of these problems so then they can gather information and go from there. And the last one principle in the Latch Circle is advocacy. And that is basically that nowadays you have to be an advocate for your kid. There's no doubt about it. Gone are the days where you're going in and you pay money or you use an insurance card and the doctor's job is to solve your kid's problem. Like, the mother, the father, the actual patient, if it's an adult, has to be an advocate for themselves. So you'll see in the Latch Circle, those values plus learn, trust, thrive go over and over again. And then how do we do it? How do we do it every day? We are radically kind, fiercely patient, disruptively brave, and defiantly joyful, because I just paired that over from my clinic. And really the mantra behind it is that we're latching onto health. We're latching onto life. And, if I was to give you guys any, I wrote down some more things, like when you're talking about, like, what are you trying to do for patients? And there's a tendency in dentistry to go right to, like, I don't know, talking about teeth, talking about airway. Really what you're trying to do is you got to give them, words that are action words. Talk about freedom, talk about energy, talk about amplifying your life, talk about exploring your future, being your own hero. These are all, I wrote these down like 10 minutes before I got on with Sarah. This is the stuff that I get excited about, because what this is at the core of it is behavior management. It's behavior management for adults. You're managing them through your brand. Delight with possibilities, trigger a new you, convert your health, find yourself. Those are all, you can steal any of those and you don't have to give me credit. But like, what I'm saying is that is what you're trying to do. That is what people are going to get inspired about, because if you do that well, and I'm not about sales. Sales always takes care of itself behind my brand. But like, if you do that well, they'll sign on the dotted line. I believe if they see the value, they will sign. So I have families coming to me that are from far away, that don't have any money, and they see the value in the Health Latch Clinic. So, okay. So I want you to know that this is the one pillar that is written, and it is about tongue tie. It is getting filled up pretty quick as we add more members. So basically, patients can come here. You can even send your patients here if you want already. Dorothy Nelson was telling me she's sending every patient here, which is amazing. There's articles in here. There's videos in here. There's patient stories that literally my team took patients and wrote a whole story about them, interviewed them, and with this beautiful baby and their story and what happened, and everything's clickable, everything's searchable. My entire team on the actual Learn page, every one of these words is optimized through the World Wide Web. So when I say every one of these words, literally every one of these words, and if you can imagine, I built a structure that can grow on top of grow on top of grow on top of grow. There's an endless amount. But when you come here at first, it's going to be more about tongue tie, because the number one word that people are searching for everything, including myofunctional specialists, is tongue tie. And to me, that's kind of unfortunate, because you guys are so much more than tongue tie. But it is what it is right now. It has 100% conversion rate on the web, which means that people click on something and then they click on something else and then they click on something else. It has an unbelievable amount of staying power, which means people are very intrigued by it, obviously. But I think that overall, you're going to see the Healththat Circle talk more about the big picture, which is airway, really airway and muscle movement. So the trust part is just basically, I really do believe we have to earn some trust back, because there's a little bit of mistrust with healthcare right now. And so there's some fun videos, really nice videos that we created. And then the thrive part has to do with the circles. And I'll show you that in a second. So people come on and they just click on here. As a parent, you'll join for free. As a provider, there is a fee, because I want you to know that this is, how do I say this? This is very expensive for me to keep going by myself. People are joining, which is great. But the only way something like this gets bigger and better and more parts to it, and Zoom inside and charts, that's where I'm heading. I'm heading towards interconferencing inside of it. I'm heading towards charts going back and forth inside of it, HIPAA compliant. But the only way this goes is by really the content. The content has to keep coming. It has to be good content and keep growing. So you sign up as a health professional and then you get an account and you're in. So I already have an account. So you see my login. The nice thing is the socials right here. So you can share anything from the Healththat Circle with anybody through all the social.
Well, I think really quick, it's a great way when us therapists need some, how do we educate our patients on this and make it look like it's a legitimate thing? Like go to this website here, send people to the learn part. And then if you're a provider on there too, then it's like, okay, there's this amazing website. You can be listed. There's a little bit about you and what you do. I think it's really cool.
Yeah. Oh, for sure. For sure. And the one thing you guys understand is it's all about, it's just like anything in life. It's strength in numbers is really what Sarah's talking about. And even on the World Wide Web, like your individual, let's say your myofunctional business, right? I'm talking a little bit about business strategy, is optimized through the World Wide Web as one person, as one clinic, right? But when you're on a group like this, where the general public is coming and they're staying inside to learn, your optimization through the Healththat Circle membership is super high, because you're all linked to all these different providers that are all talking about it as well. But you'll eventually log in, and this is how you build out your platform. Basically, you go through and you put in all your contact information, you geocode it, you put your address of your location in, and man, oh man, there's a lot of social linked to it, which is good. And then you just hit save and continue, and you just build your profile. You go through, put your logo in, and you can eventually see what your profile looks like by just clicking this button. We tried to make it as simple as possible. At first, it was a little complicated, and Richard Baxter looked at it and he said, "Dr. Thomas, this is too complicated." But anyways, so we pared it down. But here we go. Here's the circle part that I don't think it's very confusing, but like I think maybe some people get confused. So you actually will click on select my circles, and you will click the different professions that you potentially work with in the Healththat Circle. And these are all the professions right now. I'm probably going to have to add some as more people come to the Healththat Circle. And as soon as you do that, you click view my circle. And then each of those categories comes up, and you literally hit browse dentist, and you find a dentist that you work with.
Assuming there's Dave and there's me, we're already listed.
Yep. So then at that point, you can go to their profile. You can remove them if you want to remove Sarah from your circle.
Totally.
No. And then, yeah, but it's starting to grow. So it's really neat. Searchable wise, like the general public can come up and say, I need a functionalist, right? And I need a functionalist that's a myofunctional specialist. And then they just type in their zip code. So like my zip code's 98004. And obviously Big Dave's going to show up here, I think. And you
I
just
think
hit
so.
search. And then it just says how far they are away from you, the listing. Barbara's on there as well. We wrote an article about both of you guys, which thank you so much for doing that. My team loved you guys. And so, yeah, and so that's the power. Now, the one thing I'll lastly say is, the providers are making these circles, right? And I wanted to keep this radically kind with our values. So there's no threads. I don't need another thread that I have to maintain, because I know this is my personal opinion, but Facebook is ruining all of this for all of us. And I'm not just saying that to get you in the Healththat circle. I really think that there's people on there giving, consultations about myofunctional that know nothing about myofunctional.
Yeah.
I mean, I know you guys see it all the time. On the tongue tie side, people are scared to go. People are showing pictures and getting, let's say, diagnosis of pictures. And it's just
those Facebook groups are out of control. It's just
yeah. You won't see me unless I pick out one person and instant message them behind the scenes, and I try to help that person. But you won't see me ever on Facebook. I have a page for the Healththat Circle, but I actually used consultants to build this, and they were like, why would you build a feed that everybody can talk on if you already know what the major problems are? Why are you going to have this whole discussion about all these other things and these side topics if you're saying this is the pillar tree of what you need to do to find a good myofunctional specialist? So that's what we're building. The 5 pillars are eventually going to be, and they're coming by the end of November, my team promised me, and that's a big feat. But
okay.
early childhood cavities, oral dysfunction, oral restriction, airway, and the last one's going to, airway, and the last one's going to be sleep. So
Wow. I love that.
Under
That's
the Learn
amazing.
section, those 5 topics pillar paged and growing exponentially as more and more members bring their stuff here. Because the thing you got to understand is, like, when you look for like a proceduralist, right? And you find all these proceduralists, right? And Maggie Graham's a great one in Milwaukee. And then you can, the general public can send her an email message or whatever email you have on file. Here's all the search optimization. So if anybody was to type in any of these things having to do with Milwaukee, her Healththat Circle profile would show up #1 on Google. And then
Wow. Okay. I didn't know that. Okay. So this is very Google optimized.
totally Google optimized.
Okay.
Yeah. No, I went through a lot of, I always say I'm like the guy right now. I feel like I'm the guy from Jurassic Park where he walks the people around and he says, I spared no expense. I think that's his line, something like that from Jurassic Park. Someone can write in that line. But the last thing I'll say is, how providers are making their circles? What's going to happen is the patients will be able to make their own circles as well and share them socially through the Healththat circles on social. So it's not only where the power behind the Healththat circle comes is like parents or providers are making circles, so the parents can go in and see their circles and see who they're working with, who they're collaborating with. And that's where I think the big bump for myofunctional specialists come, because I'm just going to say it because I'm bold and I'm transparent, but a lot of people are talking about how they're using myofunctional specialists, but there's a lot of people not using myofunctional specialists. And we all know, that the outcome is going to be so much greater with a myofunctional specialist. So like the circle would show like who their myofunctional specialist is, and I would say that the general public, once fully educated by the Healththat Circle, would say, well, this doctor doesn't have any myofunctional specialists, so he might not be getting the whole picture, right? So there you have it. There is the Healththat Circle. The 2 things I'm working on right now is in membership. I'll be honest with you, membership has to come up a little bit so I can keep applying finances to it, but is charts inside, exchange of information, HIPAA compliant information between 2 doctors or 2 providers. And
that sounds
then,
really cool.
Yep. And then the ability to have like side little study clubs. And, but I will tell you that if membership does grow on the Healththat Circle, with the way that I built it, like the sky's the limit. There's this aspect we built into it. I know we're in COVID right now, but there's this, we haven't even turned it on, where we can actually show what conferences everybody's going to. So you don't even have to like say, are you going to this conference? You can click on the member and see where they're going to be.
Awesome.
So if you wanted to stalk Sarah, you could stalk Sarah wherever she's at. But yeah, no, it's,
I'm happy for people to stalk me. That'd be really fun.
no, but it's kind of endless. So, but it's ready to grow. And I really think it's going to start with probably the dentists are usually late to come because they're late adopters and they're just hard to move, to be honest with you. But I think we could really do something with this, guys.
Cool. Well, I'd love if you want to take some questions,
Sure.
Dr. Thomas.
Sure.
Why don't you all have the ability to raise your hand, and I would love to hear some of your voices. If anyone wants to raise their hand and ask a question, I think that's always my favorite way to interact with you guys. So don't be shy. Click the hand raise button. I'd love to bring you on audio, and I know you guys have left some great comments, but does anyone have questions? And I have a question if no one else does.
Dave, I'm glad you found it super easy to set up. I appreciate it, bud. Yeah, we put a lot of time into this to make sure it's easy.
Yeah. Well, my question is, I know you said that you're super transparent. Do you want to just talk about costs so people know,
Sure.
like, to sign up, what they are looking at? I'm sure that's one of the questions that nobody else wants to ask, but.
No, that's easy stuff for me. I love transparency of that. So the dentists pay around $750 a year. To be honest with you, I was kind of nervous about that just because I'm always kind of nervous with what people think about money.
Yeah.
But the way I came to that was how much this is taking to keep this going is one. It's not easy. I'm carrying the load right now, which is fine, the major load. And then I just basically was like, what would be the return on investment, right? Like if I could push one patient into we call them functionalists, and that's what you guys are, functionalists, proceduralists, and then structuralists, or the orthodontists and the ENTs and the face movers and all that kind of stuff. But what would be the return on investment if I could push one patient into their office? And my expectation is I'm hoping I'm getting a lot more than one patient to each of your offices or each of your businesses in a year.
Yeah, for sure.
Right.
And so, in reality, I mean, the cost of all of our CE courses, I mean, everyone here has paid a significant amount of money to further their education and knowledge. And so I think if you divide it up over the month, like what is $700 a year per month?
Yep.
And that's just the cost for the dentist. So
that's for the dentist. That's for the proceduralists and the structuralists, basically. And okay. So this is the thing that I had to ask my team to do a lot. So when I decided that I was going to obviously include doulas and midwives and all the functionalists, right? Lactation consultants, right? I definitely did not want to charge them the same as the proceduralists. So the number I came to was around $400. So I just charged a little bit more for the dentist, but I came up with, I don't know the number offhand, but I think it's $179 per year for a functionalist. And you can break it down by month if you want, or you can pay it all at once. And again, that kind of goes back to like where the earning potential is for the functionalists. And sure. I wanted them to be a part of this for sure. But on the software side of things, the software could not do that. It could not take 3 categories and have one pay less. So I actually had to build 2 software programs and connect them together in order to just make it so the functionalists could pay less money. And that's fine. It ended up working out. It was a little bit of a stumbling block, but we got it done. And
so it says, people are commenting, it's $195 a year on your site.
There you go. Sorry.
That's all right. You're in the operations. You don't necessarily have all that stuff down. So yeah, there are some good comments here. Kushbu's got her hand up. I'm gonna just unmute you, Kushbu, if you want to talk. You're on. Just unmute yourself. There you go.
Hi.
Hey.
Okay, so I just have a quick question. So is this per doctor or per person, or per practice?
It's per doctor, per person. And yeah, we want the people to interact individually, basically.
Okay. Okay. I just wanted to check because I know we were kind of looking at both of those options. So,
Yep. So, because like traditionally, like we want to be able to write stories about people individually, link them together from different pages. If you can imagine those 5 pillar pages, we want them to talk to each other. So like if someone's in the airway section and they're like, oh, what is a frenum? They click a button, it drops them over to the free, the oral tether page and oral dysfunction page. So
perfect. It's amazing.
Awesome. That's a really good question. And it actually, I like the idea of people having to connect and like bring people into their circles. So one clinic might have 4 different providers and now their circles are all linked automatically. So it's I actually really like that.
Yeah, and the thing is, real quick about the circles, like how I came to that conclusion was trying to figure out how to be radically kind about reviewing people. Okay. Because like I didn't want to be a manager, a micromanager of how people get reviewed and people getting upset and stuff. So I actually sought out some counsel and they're like, well, why do you have to tell that? Why does it have to say if people are bad? Like really all we need to know is who is good, right? That's what we need to know. And so that's what the circle is, because eventually there'll be a tally next to your name and it'll say how many circles you're in, basically. And I would say the general public would be like, wow, this person is a collaborator and they work with people and people like that. I guess you would say like them, I guess. But it was just my way of reviewing someone without having to say the good and the bad about them. It's just like, hey, this person's good.
Yeah. So the idea is like the providers who are better will have higher numbers and then people can look for those people. So,
and we're looking at like different things like banners and badges. There's going to be a whole CE page, like all your CE can be listed on the Healththat Circle for free.
Ooh, I better get MyoMentor on there.
So like everybody can go to one place and see all the CE that's happening, right? And so, but just like badge, we've been talking about badges for like those super big courses, like for each of the professions. Like obviously Richard Baxter's course would be kind of a ideal course for the functionalist to be taking, 20 hours of CE course. So
yeah.
Did you have a second question?
Yeah, Tanya's got her hand up too. I'm going to click on you, or I'm sorry, Tawny. I always say that wrong. You're on, just unmute yourself and you can ask us a question.
Hi there.
Hey.
I loved what you talked about with mission statement and principles. And I've been a hygienist a long time, but I'm just starting my myofunctional therapy business. And so I haven't even gotten to mission statement yet or anything like that. So I was just wondered what your recommendations were about how you figured that out for yourself, or what exercises can we do that will help us figure out what those would be.
Yeah, I mean, it's really playing with words for me. It's actually having silence. I would encourage you to have some silence. And I know that's hard in a noisy world, but where you literally kind of zen into a room and you just start thinking about like what you're going to do for people. I have a lot of fun when I'm going through that process. My wife and I have a lot of fun doing it together. But I like adjectives, like active words, like what you're trying to do for people. You're trying to, like I said before, you're trying to give them freedom. You're trying to give them, I give you the example, hopefully I'm answering your question in a roundabout way, but like Red Bull is like a horrible drink for the body, right?
Yes, it is.
It's like we all, maybe some people here love it, but there's no doubt about it. You're pouring gasoline into your tank, right? So, but Red Bull, they have killed it with the slogan or the mission statement. It gives you wings, right? What does that have to do with Red Bull whatsoever, right? But the general public thinks I get energy, right? And if you could do anything for any of your patients, right, and any of your brands, any of your missions, is like if you could actually bottle energy and put a cap on it, people would pay whatever they possibly had to get a bottle of that energy. So when you're going through your mission statement, one, it should be super short. Like these mission statements, you should be able to repeat it like how I just go into it, right? Radically kind, fiercely patient. Yeah. Like it should be repeatable. And it should be you, it should be fun. Believe it or not, I don't believe in like hiring, like maybe a a coach could help you through that, but it's something that you really have to wrestle with. So just start jotting down words, and usually like 3 or 4 phrases will come together and come to light over time.
Great idea. So the name I chose for my business was Tongues and Cheeks, Myofunctional Therapy. And there's was no tonguesandcheeks.com or anything. So I felt like I scored, but I'm still working on the logo and all that stuff. So,
sure.
But thank you so much. I appreciate it. That's great advice.
No problem. No problem.
Great question. And I love this stuff too. So this is we can nerd out on the business and branding and all that stuff for a long time.
Yeah, because the one thing you got to understand is your brand is your legacy, okay? Because eventually you're going to turn this over. We don't think that we're going into this and you're building your own businesses tongue in cheek. That's awesome. And it's not going to be successful, right? You're thinking this is going to work and I have to make this work, right? And that's what makes us the entrepreneur. But eventually you're going to have to hand it over to someone. And if it has anything to do with your name or anything like that, it's just difficult to let go and transition out. And really the brand is what gives you legacy. It gives you legacy for my faceology is going to be legacy for a long time to come, right? Yep.
Thanks.
And they'll remember Sarah for sure, but they're probably going to remember my faceology. So, okay.
Thank you.
If anybody wants to send me little branded stuff and have me take a look at it, I'd be glad to.
That's a super nice offer. I wasn't going to give anyone your email address, but you might have to type it into the chat if you.
JMT, James Michael Thomas, JMT at healthlatchcircle.com.
JMT at healthlatchcircle.com, you guys. So that's a nice offer. Kushbu, you got your hand up again. Is that a mistake or do you have another question?
Nope,
oh, she
sorry.
put it down. Oh, wait, you're on.
No, I guess I didn't lower it. Sorry.
Oh, it's all right. No problem. All right. Any more questions, you guys? Does anyone want to ask anything? I mean, we're right at an hour, I'm guessing. What time is it? Yeah, we're past an hour. So we're happy to wrap it up unless you guys have any last words, any last comments, anything you want to share, ask, whatever.
Can I say one more thing? I know I've been a talker, but I'm just trying to give you as much as I can.
Go for it.
So execution is key in what you guys do. If you don't execute with your patients, they don't get the care, they don't get the idea, they don't get the breath, they don't get all that kind of stuff, right? So simple, right? That's what I'm trying to do with the Healththat Circle. The more simple you make it, the better, right? And there's 2 ways to, I wrote down, there's 2 ways to execution. One is implementation, and that's what dentists like to do. They like to make things and just push it through their teams, and they just say, this is how you're going to do it, and I'm going to reward you or fault you if you can't do it this way. And the other one's integration. So it's either implementation and integration. And there's only one that leads to execution, and that's integration. So what you guys have to do is figure out how to do myofunctionally integrate it into their life. If you just implement it into their life, you're not going to be very successful over time. But if you basically, execute by integrating it into their life, I think you'll hit the stars. So that was just kind of a thought I had right before I came on.
Awesome. I love it. Well, thank you guys so much. I'm so glad that you were all able to join us tonight. This will be recorded. I think, Dr. Thomas is willing to share the video for any of you guys who, weren't able to join live and all that. So that should be coming soon. But, thank you, Dr. Thomas, for doing this. Thank you for sharing all this amazing information. I mean, just based on the comments and the questions in the chat, it sounds like everybody really enjoyed this, and they're feeling inspired and excited by everything you had to say. So
thank you so much, guys. It was an honor. So thanks, Sarah. And reach out anytime. I'd love to help any way I can.
All right. Thank you so much. I guess I'll just let you guys all go. All right. Bye. Have a great night.
Bye.